have Dr. Tejaswi, who will present on a very, very interesting topic that is on dementia. And I'll talk about Dr. Tejaswi a bit before we start. Dr. Tejaswi Rao is a consultant neurologist with expertise in memory disorders, dementia, and stroke care. She's dedicated to raising awareness about neurological health and helping patients and families understand the difference between normal aging and early signs of cognitive decline. So let's hear from Dr. Tejaswi. Please go ahead, Doctor.
Hello, sir. Thank you so much for the wonderful introduction and having me here to give me this opportunity to give patients the intro of how to identify whether it is early sign of dementia or ignore it as it is simple forgetfulness. So, hello everybody. So, I'm Dr. Tejaswi, consultant neurologist at ONUS Neuro Institute of Champapet and ONUS Nexus Neuro Clinic at Uppal. So let's dive into the topic. I'm sure everybody, we might have noticed once in a while that we walk into the kitchen and we forget why did we land it here. So don't worry, you're not alone. I do get a lot of patients asking me this question time and again. And so let's clear that confusion today. So to introduce, basically these three words, forgetfulness, aging, and dementia are interchangeably used by the public. But thankfully, they are not the same. So, to give a basic idea of what each and every word means, so forgetfulness is just inability to recall a stored memory. It can be aging, but it can also be a sleeplessness or a stress or distraction for that particular moment or a side effect of a medication. It could be even depression or a underlying hypothyroid, basically, or even a febrile illness, a fever where you will be fatigued and you will be distracted to not know and remember each and every detail of that particular day. So that itself gives an idea of how simple forgetfulness can be. Normal aging, on the other hand, is actually gradual and universal. It's not just about memory, and it is a non-disease related changes that a human body goes through, because from birth to death we do have to go through changes over time. So it's universal, and more importantly it is very slow, and it happens in each and every domain of the brain function, not just about memory. And also some genetics and our lifestyle changes, our food habits will have some effects on the normal aging as well. Whereas dementia, it's not just a single disease, it's an umbrella term which we use for rapid, rather decline in the mental abilities, equally global and universal as aging, but faster, and which will have a debilitating effect on the patient. However, it is important that it is not a lifestyle or it is not an aging factor that causes it. We should be knowing that there are some causes which are responsible for dementia, and most of them are actually treatable. There are only some of them which are genetic and degenerative, which can be managed to a great extent if identified early. So the common symptoms where dementia involves is basically forgetfulness, that's memory, difficulty finding words, difficulty problem solving, difficulty planning their day or organizing, misplacing minor things. It may start with minor things, but it may end up with major things that will involve their medical bills or insurances or passwords, and increasing confusion between day and night, and then following difficulty following any conversation in that particular order, and losing the touch while having a conversation, one-to-one conversation. These are the minor symptoms which we can think of, concentrate on beyond forgetfulness, because forgetfulness is just one part of it. So, what are the types of dementia we have? Like we discussed, it's an umbrella term. So, what comes under the umbrella is the degenerative kind of diseases are commonly 60% of dementia, which is degenerative, is Alzheimer's disease, the well known Alzheimer's disease. But there are other degeneratives also, diseases also like dementia with Lewy body, vascular dementia, commonly seen with hypertension, diabetes, and stroke patients. Huntington's disease, we all are very much aware that it is a genetic familial disease which travels through generations. Korsakoff syndrome is something which happens because of vitamin deficiencies. And there are other types of dementia like frontotemporal, HIV associated, Parkinson's associated. The right side picture is giving us a gross idea of the common dementias, that is Alzheimer's. And the second is vascular, which happens because of the impairment of the vessel flow. Can be hypertension related, can be cholesterol, diabetes, or a background of multiple strokes that happened over a period of time, and then which ends up into faster decrement of the global brain functioning, leading to dementia. So, like we discussed, these are the types of dementias. So, to know dementia, the dementia signs are more than just, like we discussed, it's not just memory. We also have difficulty thinking and management and problem solving, vision. So this is the most important slide today for the general public to identify and reach me as early as possible. So difference between the normal forgetfulness and dementia. So the memory lapses in normal forgetfulness are very occasional. It will be very minor things like wallets and keys and misplaced items, which they usually, more often than not, they recall it. But when it comes to dementia, it's more frequent and it get worsen over time, and even after a duration of a certain time, they cannot recall it. Daily functioning. So normal forgetfulness, if the patient is having normal forgetfulness, most often they can manage the daily task and they will have no dependency when it comes to their self bathing or managing bills or cooking, having their meals. But when it comes to dementia, along with forgetfulness, they will also have difficulties managing their daily tasks and may need assistance for their personal care. Like they may not remember eating, they may not remember bathing or things like that. Repetition, people with forgetfulness may ask to repeat what they said or may keep asking it again, only if they have been distracted when the first situation happened. But it is very rare. When it comes to dementia, this is very frequent. And not just the same question that they ask, but they keep performing the same task or same movement of their hands or cleaning the surface again and again, writing a note again and again, and things like that. Normal forgetfulness, people will not have disorientation about the time and the month and the season, and they rarely lose directions to their home when they are outside or directions within the home. Because unfamiliar places losing direction is normal because we have never been to this place. It's okay to not remember the way back. But familiar places is what is mainly concerned with dementia. Because in dementia, the places which we go to every single day for most of our lives, also we may forget. And we may lose our path and may land in some random place which is not safe and may not be able to return back because you don't have enough memory as well to give the phone numbers to the attenders or bystanders who may try to help you. So it is important to identify the symptom because this is where people with dementia get lost and they will be confused about time as well, whether it is morning or evening, where are they? They might say that they are sitting in a place which is completely random. They might be in the hospital, they might say it is in their bedroom or things like that. Another factor or another domain is language, which is major domain when it comes to brain functioning. In normal forgetfulness, there might be occasional tip of the tongue phenomenon where we are like, we know what the word is, but we cannot utter it. We try to recall. Sometimes we may recall and sometimes we may not. Difficulty finding the right word, but we may be able to compensate that or substitute that with another synonyms because our thought process is intact when it comes to normal forgetfulness. But when it comes to dementia, you will not only not recall that particular word, but also lose the thought and you will not be able to follow the conversations which the other person is also communicating with you. And this also involves losing, not able to recall simple words, not just the complicated words. And another, judgment. In normal forgetfulness, there is no impact on judgment. You can take your life decisions as clearly as you were already doing. But when it comes to dementia, your judgments will be poor. You'll be taking more risk. You'll be losing more money. You'll be mismanaging money. You'll not be able to, for simple example, you'll be going to a shop buying an object any item and not understand how much money you should be getting back from the shopkeeper. So things like that. There are few other domains which are also associated with huge differentiations between dementia and forgetfulness, like mood and personality. Mood is only affected by the particular day and the work, or if they are going through some stress or or a physical illness when it comes to normal forgetfulness. It is otherwise not affected, even when you are forgetting things. But when it comes to dementia, mood is more often than not affected and mostly unnoticed because people concentrate so much on memory. Dementia is not just about memory, so they miss these minor changes in mood. It is not necessarily aggression or anxiety. It can also be withdrawal and depression. So it is not necessary that they are being withdrawn just because they're forgetting things. There might be a major factor of depression associated, where the patient may need much more care than the usual person with memory loss. And they also have hallucinations, not just the auditory hallucination where they hear words, which is more common with a psychiatric disease. When it comes to dementia, they see more of a visual hallucinations. They see animals walking around, or small children running around, or insects crawling, which kind of aggravates their fear and gives them horror to even tell other people. And there's a lot of social stigma associated with hallucinations as well, because of the psychiatric illness associated with the uh, auditory hallucinations. This is the time where they miss the care where it is actually needed the most. Insight is the patient being aware that I am going through something. Forgetfulness, more often than not, people know that I forgot, and that is where they are actually cautious and maybe overcautious, thinking that this forgetfulness may be a brain disease. But when in dementia this happens, they forget more than normal things, and they are not aware. Not only not aware, in occipital associated dementia, lobe associated dementia, they often deny that, and they will be very aggressive in denying that they are having this forgetfulness or other changes. And the last but not the least, the progression, like we already discussed, forgetfulness is not doesn't have to be progressing, and it will be very instinctive, and it can be fluctuating as well. It depends on your day, it depends on your mood, and many other things, and it usually remains stable, or it can even become better. But when it comes to dementia, it is always progressive, and with time, with age, they will progress, and it is high time that even the minor symptoms, if they are related to all the factors that we discussed, even one or two symptoms are associated with memory loss, the sooner the better is the treatment with dementia. And also it is important to identify the causes. So what are the risk factors? However, the degenerative factor cannot be modified, because they happen microscopically damaging the brain. But there are other things which can help us to understand that this may be a risk factor and maybe help us preventing it. In terms of sleeping, sleeping is the most important, what do you say, housekeeping for brain, because it helps us detox. So if we cannot detox, it rapidifies the degeneration of the brain. So whether we have any other disease or not, either ways, not sleeping enough will cause forgetfulness and may have an effect on dementia as well. There are certain infections like syphilis and HIV which also present with dementia. Multiple strokes, like we discussed, that also has an effect, or looks like dementia. There are many vitamin deficiencies and endocrine disorders like thyroid issues and kidney and liver damage in end stages may look like dementia, where the etiology is somewhere else. So these kind of dementias are usually treatable when we treat the primary cause. So this is the gist of the risk factor, like smoking and excessive alcohol, cholesterol, and not only not having a physical activity, but not having a mental activity, obesity. All these can actually aggravate the dementia and also make you prone for dementia in an earlier age than a normal aging. So let's go into a brief idea about what Alzheimer's dementia is, the well-known only dementia in the public. So you can see the healthy brain and the rapid and gross shrinkage of the brain, you can see the bottom pictures, which are the pictures of Alzheimer's brain patient. Okay, so this is how drastic the brain shrinks. You can see the arrow. The right side picture is the drastically shrunken brain, and you can see it is not just one particular area where the memory is involved. It is pretty global. This is kind of end stage actually, and that is how the effect of dementia will have more than just memory effects, memory loss. The right side picture is also a cross section of the brain where you can see the mass of the brain tissue is reduced to a large extent than we can expect. This is radiologically. We can also do radiological screening for patients who are maybe concerned that this may be more than just forgetfulness, where we can identify the functioning of the brain, where even the mild symptoms can be identified, and we can differentiate between a normal brain and a mild impaired brain. And whereas Alzheimer's, you can see how drastically shrunken and the functioning is affected in Alzheimer's. So microscopically, to tell you that degenerative diseases like Alzheimer's will have depositions of waste, like we discussed about the detoxification. So these are the deposits which are actually amyloid plaques and neurofibrillary tangles, which deposit in the brain, which further causes the shrinkage. These are the main reason why it happens. This may be genetic. This may be associated with other diseases like Parkinson's, or it may be idiopathic as well. It's not necessary that we can identify, and because this is how we identify after death through brain biopsy, or even before, but we don't usually go for brain biopsy for a normal living patient just because they complain of some forgetfulness. So there are many other things that we should look into, mostly clinically and symptom wise, to consider this as dementia. This is how normal aging versus dementia brain slowly over months and years shrinks. So how do we clinically evaluate? Among the domains that we discussed, we have something called mini mental status examination, just gross pictures. So based on the scoring, we have an approximate idea of may or may not be impaired. But this does not give us what kind of dementia it is. It just gives us a clue that it may be not just forgetfulness. So there's another scoring called Montreal Cognitive Assessment, MoCA scoring. So this picture, the left side picture is showing us that each and every component of brain is actually responsible for different things like animal naming, attention, language, memory. So this is how we have come up with this testing, which gives us an idea of which part of the brain is probably affected, and later we correlate it with what kind of disease it might be amongst the various dementia associated disease. So coming to the end of it, like how do we prevent? Like we discussed the risk factors. So the prevention, mainly few factors which we can think of. The diet. So we have to eat healthy, mainly the mind diet, the Mediterranean diet, which is responsible to prevent neurodegenerative diseases. That's what the MIND means. So this means involve a lot of fruits and vegetables, fresh green leafy vegetables, omega-3 foods like fish and nuts, lots of nuts. It's not a coincidence that the walnuts look like brain, because the brain loves it. So you should include them a lot in your diet. And other than that, keep your brain challenged always. Mental activity is very important to keep the brain. If you are thinking that you might be coming into dementia picture, then it's high time that you start challenging your brain. Binge watching Netflix is not a good idea. I think you should maybe once in a while go for chess or Sudoku for that matter. And physical activity, yes, definitely make yourself healthy, keep yourself fit. That itself will get rid of half of the toxics in the body. And sleep well. 7 to 8 hours of sleep per day is extremely required for detoxing your brain. Look after your heart, because some of the brain associated diseases like vascular dementia, they rely on the supply from the heart. So if your heart is healthy, your brain is healthy, and you will also prevent yourself from stroke as well, cardioembolic strokes. And stay active socially. It's not just about WhatsApp and things like that. But try to meet your friends, chat with them on phone. WhatsApp group counts too, but I would like you to communicate with each other more in person. That doesn't matter even if you're gossiping, but just keep it active. So keep your brain healthy and strong, because it's like your Wi-Fi. So you don't want it to be buffering. So forgetting keys is okay, but if you're forgetting what keys are used for, it's time to call me. So I'll be available at ONUS Robotic Hospitals, Champapet and Uppal. So do let me know if you need me. Thank you.
Thank you, doctor, for that wonderful session. It was quite informative and very clear about the differences between normal forgetfulness and dementia. Thank you, both doctors, for presenting such wonderful topics and for your insightful presentations. We will now move on into a Q&A session. I'd like to answer a couple of I'd like to post a couple of questions to Dr. Balaraju Naidu. Doctor, who is an ideal candidate for stem cell therapy in orthopedics?
So regularly, if you see, a lot of patients come for stem cell therapy starting from 25 years to up to 85 years. But depending upon the grade of the disease, we give usually for young patients around 25 to 45 years. Disease wise, stage 1 to 2. Only these are the two indications I do it in knee arthritis. Remaining all, for example, meniscus repair I give in grade 1, back pain grade 1, and tissue healing also grade 1. So, but you see newspapers, people are claiming like PRP injection for stage 4, all that is nonsense. So only very early young patients who surgery is not recommended, then we advise stem cell therapy for young patients. Yes, sir.
Thank you, doctor. Another question I have is, how soon can patients expect results after stem cell therapy?
It is like I recommend minimum time is 3 months, maximum time is 9 months. It is like a pregnancy. You need to at least wait for 6 months to 9 months.
Okay, great.
You
So
can
there
have
is some gestation period.
Yeah, gestation period is nine months.
All right. Thank you, doctor. Thank you for the answers. I have a couple of questions for Dr. Tejaswi as well.
Yes.
Doctor, at what age should one start regular memory or cognitive screenings?
I think there is no age where you should think of cognitive screening, because nowadays there is no age differentiation between young and old. Everything when it comes to brain is definitely involving young as well. When it comes to vitamin deficiencies like B12 deficiencies is more commonly associated with alcohol, where not only alcohol, our acidity levels and fast food, binge eatings, and all these things are responsible for deficiency of multiple vitamins. So they itself are a cause of a vast majority of vitamin-induced or treatable kind of dementia. So I don't think it's the elderly that we should be worried about when it comes to toxin associated or medication associated or nutritional associated dementia. It can happen in young as well. So there is no age limit where you should be screening. It starts from very young, from schooling to the very old, beyond 60 also. It's not necessary. Nowadays, we don't say 60 is old anyways. So there is no age for calling yourself old. You should not call yourself old at any age. So any age, if you feel that there is a change in your day-to-day activities, you're not able to manage your life and work as usually as you would be or as easily as you would be, I think it is a stage of concern, and that is the time you should go for screening as earliest as possible. There's no age factor.
Thank you, doctor. Another question I have for you is, what are the early signs of dementia that families should not ignore? As in, how do they differentiate between a common forgetfulness and when do they decide that it's dementia?
Like we discussed the 9 factors today, forgetfulness is just a component of memory. So we've been discussing that memory is the only point where forgetfulness comes into the picture. But dementia is everything else: planning, understanding, speaking, organizing, calculating, attention span. So everything comes into dementia. So basically, other than memory or along with memory, if there is anything else that you're not able to manage, finding ways back home, or not able to recall, or maybe in denial, your mood suddenly changes. Mood is not always psychiatric. Mood doesn't always have to be psychiatric component. So memory with a mood disorder itself can give us a huge idea about whether it is going into a particular type of dementia. The mood can be fluctuating. We have a particular type of dementia called TLB, Lewy body disease dementia, where they have very fluctuating moods. So they'll be very happy and cheerful a day, and next week they'll be depressed. So this is an indication that it is going in future, getting into a Lewy body kind of dementia, and that is the kind of dementia where it is less responsive to medications as well. So mood is also one of the very important factors where dementia comes into the picture, along with or may not be associated with forgetfulness. Memory may not always be associated with dementia in the early stages. Only certain dementias, mainly Alzheimer's, is what starts with memory. But there are many other diseases which starts with mood or vision or speech, may or may not be associated with memory as well. So it is keeping the memory part aside, I think we should concentrate on how our brain, which used to be capable of doing some things, is not now. That is where you identify that now it's time to get it checked.
More looking at motor skills.
Yes.
Okay. Thank you, doctor, for that wonderful answer. And
Thank you.
coming to the close for today's session, thank you to all our participants for joining us today. And a special thanks to our speakers, Dr. Balaraju Naidu and Dr. Tejaswi Rao, for sharing their expertise on two vital health topics. We hope you found today's session both informative and valuable. Before you leave, we would kindly request you to take a minute to fill out our post-webinar survey. Your feedback helps us improve and also lets us know the topics you'd like us to cover in the future. The survey link is available in your email, and also it would pop up in your browser after this session. On behalf of ONUS Robotic Hospitals, thank you once again for your time and participation. We look forward to seeing you in our upcoming webinars. Have a wonderful day. Stay happy, stay healthy. Thank you. Good day.